So meanwhile, I will tell you my philosophy on any cosmetic procedure, including the threads. So mint leaf, it sounds as very, well, very exotic name, but it's actually stands simply for minimally invasive threads. So it's a Korean name, and this you have to understand what stands behind it. So why the thread lift in general? I think that currently our patients looking for less invasive procedures than they used to look for. And so far, soft tissue sagging is unaddressed by injectables. I'm a dermatologist, I'm not a surgeon. I'm not performing any surgical lifts on my patients, so thread lifting is the best I can provide. I personally believe that women love the idea of threading. You do not have to convince a patient about the female patient about the thread. My next slide, please. Because this is the picture that I imagine, or my patients are imagining, you just can thread and lift the tissue. Next slide, please. Patients currently are mature to accept less dramatic results with shorter longevity because we educated them by using injectables, fillers, botulinum toxins, so they know they are mature enough to understand that if you treat glabellar wrinkle with few shots, you are going to improve glabellar wrinkles only. So if you are going to put few threads in the lower face, you're going to improve the sagging in some way. I think that there is in general positive vibe around the idea of threading everywhere in the world. The other reason is that the patients are price sensitive. So you can provide decent results with relatively low costing procedure. You make your patient happier. Next slide, please. And the additional reason for the growing popularity of the threads is that we have slowly growing up a body of scientific evidence about the efficacy of these procedures. Next slide, please. So I'm not going for deep classification of the threads, but in general, regarding the longevity, we have absorbable and non-absorbable, very similar to fillers. So they started from non-absorbable, and then they moved to absorbable. The same with the threads. I think that most of us use most of the times absorbable. I have to tell that in the last year, I hear more and more about non-absorbable threads popularity coming back to the stage. Next slide, please. And I think the incidence of potential complications with absorbable, non-absorbable threads a little bit higher, but maybe most of them are treatable. Next one, please. So if we try to classify the threads according to the materials, most of the threads are composed either from PDA or PDS, polydexanone, or polylactic acids. There was idea of solid HA. I don't hear about the threads anymore. I wonder what is happening with them right now. Next slide. Now we can classify also the absorbable threads according to their structure or manufacturing process. We have threads with cones. We have threads with cogs. Cogs can be unidirectional, bidirectional, multidirectional. Next one, please. And then I think this is one of the important considerations for me. We can classify them according to the tool by which we introduce the threads under the skin. They can be embedded in a sharp needle, then they can be connected to a sharp needle, attached to the sharp needle, that they can be embedded in blunt cannula. And currently, this is the needle that I prefer. Next one. What are advantages of cannula embedded threads? They're usually safer, they're less traumatic, and they cause less bruising. So the risk of bruising with cannula embedded threads is actually lower than with any other thread, or even with injectables. Next one. Regarding the specific characteristic of manufacturing manufacturing process of the threads, there are some cogs that are cut from in the thread, while the other one is actually manufactured in completely different pressing technology, which does not affect the tensile strength of the cog. So this cog will actually catch the soft tissue, will lift it, and the chances for the cog to tear, to come off, is very, very low. Next one, please. So I'm presenting currently the mint lift and the mint lift line, and we'll have two threads, mint lift easy, and this is the and fine, and this is what I'm going to actually to show it to you. And I think that it's enough for the presentation. We go now to our patient. So the first part of the threading procedure. Okay, here we are back. So this is my patient. The threads are addressing soft tissue sagging. We need a patient with not a very significant sagging, because in this case, she will be referred by me to a surgeon. So mild sagging can be addressed by threads. My patient has to have a decent skin quality. Bad skin quality patients are not good candidates for this procedure. And we can always combine threading with injectables, with fillers, and I do it usually in the same session. We do not have to separate it. So after cleaning the face, the assessment and decision by the procedure where I'm going to put my thread is a crucial one. We have to remember that two very simple principles have to be memorized when we are using suspending devices. The lateral part of the face, this part is fixed, this part is more mobile. So we're introducing our thread from the fixed part, trying to lift the mobile part. This is the first principle. The second principle is that the deep fat compartments are fixed on the bone, while superficial fat compartments are mobile. So I introduced my thread deeply, and the other end of the thread is going to be more superficial, and superficial fat compartments, and this is what actually allows me to lift. So from lateral medially, from deep more superficially, this is the general principle of working with threads. Now I'm trying to find the vectors, whether usually it's a mid face, lower face, or both. And I do the same assessment as surgeons are doing. What is the best direction to lift the face in this case? So I think that I start with from mid face. My direction is going to be mid face elevation, fixed, mobile, and then the lower face is going to be performed. Okay, we need to do it like this. Okay, sorry. Lateral medially, fixed, mobile. So this is my vectors. You can play with the vectors, and I usually do it when the patient is in the sitting position, so to make it much more precise. The second, so the cleaning, marking, anesthesia.
Marina, you have more 6 minutes.
Yes, well, almost. Please open it for me. So now I put anesthesia, lidocaine to the introduction entry points. I do one side for the sake of the demonstration, then I do the other side after the procedure. And this is my threads. I will show them. I use my fillers trays just to keep the threads in. No, I just leave it. Don't need another one. So this is, now I don't discard. Can you show it? Okay, this is with the threads. They are 15 centimeter long. They're introduced to 18 gauge cannula. So can you come here? So what I do, I create a hole perpendicular, remember, from deep to more superficial. So this is my entry Now I take the cannula, I open it up, and this is how the thread looks. It is embedded into the cannula. I introduce it through the hole that I created, and I'm following my markings from deep, more superficially. I usually do not anesthetize the central part because it can give bruising. I stop here, I take my cannula out, and you can see the thread, and I can pull it now, and I can decide how much I want to pull. Usually I introduce 2 threads per each side, per each area. So the second thread is introduced through the same entry hole. I don't create another one. And I just change the direction of my thread. Okay. Now I have 2 threads at the same hole, and I will do the same. Now I need the needle. Thank you. And I do the same procedure to the lower face. Deep. Thank you. Going more superficially. Sometimes if there's any fibrotic bend, it can be a little bit more challenging, but in general, it's a very easy procedure. No, we don't. But what I do, I just hold the thread with my finger. Can I have the other one? Yes, thank you. Okay, that's it. That's it.
So Marina, you are in the superficial fat compartment of
Yes,
this area.
I start laterally from the deep fat compartment and introduce it more superficially. Again, the idea is to move from fixed tissues to mobile ones. So the lateral part is fixed, the medial part of the face is mobile, deep fat compartments are fixed, superficial fat compartments are mobile. So this is the idea. Can I have my scissors, please? Okay, yeah, thank you. I think that you hold them. Now I just pull the thread, and as you can see, the suspension is very, very significant. At this stage, I tell my patient, I usually give them a mirror, and explain that at this stage, I can hand them to the ceiling. This is how these cogs are strong. So the end stage is just cutting the ends of the threads. And at this point, actually, one side is done. Look at me, please. Usually, it does not require more than that. It's a little bit. It was a little bit quick here, but it takes me not more than to inject 1 ml of a filler, and this is how the patient leaves the clinic.
So you just
holes.
clean and not molding after, no, just clean to keep
I cut
the
it,
integrity.
I bury the ends of the thread under the skin,
Okay.
and this is how patient, usually the risk for bruising is very, very low. So
Okay.
2 threads here, 2 threads, I introduce them through the same hole, the mid face, the lower face, 1 hole is used. So in this stage, it becomes less and less traumatic. For those who want to have a little bit even more significant result, we can tie both ends of the thread and create small knot, bury it under the skin, and cut it out. It's a little bit more time consuming because you told me that I have only 6 minutes left. I decided just to give it up.
Okay.
But again, you know, this is what I tell my patients, my colleagues. This procedure actually provides you the right balance. What you invest, what you get. Simple procedure, not time consuming, simple for both for the doctor and for the patient. Low rate of complications, in reasonable price. I think it fits exactly patient expectations and what they get from this procedure.
Okay.
It's not a surgical facelift.
Marina, the audience is asking to put the patient in a normal position.
Can you sit up?
Seated more,
Can you sit up a little
a
bit?
little bit more. Yeah, just to compare. It's very evident the result. And your average of threads for each side is what, 2 or 4, depends of the
It
patient?
depends. No, I use, that I'm fighting the approach of full face. I'm trying to do what I call the Achilles heel.
Okay.
Minimal to create maximal possible effect, because this is what creates reasonable pricing, reasonable discomfort, reasonable downtime.
Okay.
So it's usually 2 threads per side, per area. So if it's only mid-face, it's two threads one side, 2 threads other side. If
Okay.
I do both the mid-face and the lower face, 2 to 4 threads.
Okay, thank you. Very amazing result. Congratulations, Marina. Thank you so much.